it's amazing from a care standpoint that a lot of people just leave the care to the nurses, right? You need the care of the doctors. We talked about that. I want to talk a little bit about being your own patient advocate or being an advocate for the patient. Because there's, if you're in the hospital for any number of time, we like to keep a log book, right? Or a log sheet or something, because we'll ask questions like, when is this medication due, right? Because one nurse might say, "Oh, tell you what, the doctor said you could have it every 4 to 6 hours." And then, so we write down 4 to 6 hours, and then we write down when the next dose should do. Or, can we really have it on the 4-hour range? Or, they're supposed to get this particular one at this time. And then when there's a shift change, the other nurse might come in and say, "Oh, no, this it's okay. They had it. You know when to go search out, right?" So let's say they're supposed to have one medication, and they've had it, and it's been 5 hours, and then the new nurse is nowhere to be seen. If you don't advocate for yourself and you don't know what to, have a record of that, you're going to just wait. And, the next thing you know, maybe, it could be for pain, it could be for something else, but now you're pushing the envelope of the outer range.
Right.
And so let's talk a little bit about, what maybe, things like that. Should patients, keep a little journal or a sheet? Is it okay for them to say, "Hey, I just want to confirm, I want to even though they did a handoff, I want to confirm when they come in that this needs to be done in this period of time," right? So let's talk a little bit about that.
Yeah, absolutely. You have every right to know what the doctor ordered. And if they say for pain medication, and usually that's correct, it's every 4 to 6 hours on a lot of those medications, it is your right to say, "I would like to see the doctor's order," or "I would like to know what the doctor wrote," and then just advocate again. Hey, we're in that 4-hour window. I highly suggest, as you said, taking notes. There's so much to remember. It gets so confusing. And that really is only your resource when you ask those questions and then write down and have the answers, right? So I think that's a great process to do and highly recommended. And then you have your notes to go back and forth, and then you can ask more questions for clarification. So I'll just add this in there real quick with pain medications. Some nurses are a little more judicious, and some are, have different feelings on how much pain medication a patient should get. And they'll put their personal, bias in there or whatever. If it's written or the patient's pain is not being controlled, of course, we need to look if there's another reason, like this poor man with his foot and the perfusion. But it is the expectation that the nurse will call the physician and say, "Hey, this dose of pain medication isn't working." So they are supposed to be the patient advocate. In every state, there's something called the Nurse Practice Act. And number one responsibility is they have to be the patient's advocate. So if that's not happening and you're noticing that as a family member, speak up, because that is their requirement for that nursing license that they carry. You brought up something too, and I wanted to touch on this a little bit about what should we expect as family members, and then going back to your question about common preventable medical harm. And healthcare acquired infections is another really big one. So it is different routes, but number one, what I could say, different routes of transmission. Number one is hand washing. So healthcare, whether they're physicians, respiratory therapists, it doesn't matter, phlebotomists, nurses coming into your room, every single person coming into the room that's going to touch the patient should wash their hands. Not just put on a pair of gloves, they need to wash their hands. That is the transmission, the easiest way to prevent infection. And so that's another big one. As a patient advocate, you can just say, "Hey, doctor," yes, doctors, you need to call them out too. Say, "I understand that you need to wash your hands to protect my wife, my son, whoever. Can you please do that before you come over here?"
Will they be offended?
If they are, tough. Would you rather offend them or potential of infection happening to, your family member? So they need to get over it, because the more informed the general public is, healthcare is going to have to step up and do what they're expected to do and not take shortcuts.
Right. Yeah. And you know what? You're in a hospital and they have, if you're in the patient's room, they have wash your hands, right? They have
Right.
wash your hands if you're in the room, in the
Yes.
bathroom. So, and I've, I've been in there a lot. The nurses will come in and may change their gloves. I don't see them washing their hands. A lot of times they'll use antiseptic or something, to kill germs. I don't remember really any doctors doing that when they're making the
Right.
rounds. They come in, so and you can do it in a nice way. You
Yeah.
can do it in a nice
Yeah.
way. It's like, hey, did I don't know how clean that door is, but can you just wash your hands really quick? Yeah, it's like, they'll probably go over and do the same thing. They'll just, and then
Yeah.
and most of the doctors I know would be like, oh, okay, but you're right, because they know they're supposed to do it. Yeah.
Yep.
We've talked about so many things. If there was, and you might have talked about these, but I'd like to summarize them anyway. If there were 3 top takeaways you would want someone to know about, advocating for themselves, how to prepare, whatever, from from either a patient or a provider standpoint, what are the top 3 takeaways you want people to go
I would
to?
say,
It goes along with your mission to save 10,000 lives.
yeah, absolutely. Become informed. There's no reason nowadays to not know something. I think the biggest thing is most people don't know they need to know until they're in that situation. And then they're like deer in the headlights because they feel very vulnerable to the healthcare system. As we talked about before, the authority gradient, doctors have had, 8, 12 years of education. Nurses have had 2 to 4 or more years of education. They should know. Yes, they should. But we have to rely on ourselves to advocate. So become informed, I think, would be the first one. And find that confidence in communication. As we've talked about, do it with gratitude. It's how you say it sometimes and how it lands. But I know that all of us who have healthcare background, I know I would appreciate, hey, can you come check my dad? He's just not quite right. And over time I've learned when they say that, something's going on. It isn't just like, and so become informed, advocate for sure, and understand the various ways that you can be a partner in healthcare for your own or your family members, because it's vast. There's a lot going on and it's fast paced many times, but even just becoming informed to know, hey, what was my dad's lab values this morning? I know yesterday, his potassium was low. What is it today? Or his hemoglobin was borderline. Is it better today? And then they come back and say, oh, yeah, it's not so great. Oh, well, what's the plan? Ask what the plan is. Ask for the results. Another big medical error is diagnostic errors. Some of that is just lack of communication. So in the book, there's another story about a man who had a tumor. They thought it was benign, had the tumor taken out in surgery. Family assumed because they didn't hear anything that it must have been benign. 6 months later, he's got another headache that won't go away. Did another CAT scan. The tumor was back. It was malignant, and he died 4 months later. And then they went back and realized, oh, the first tumor was malignant. So you can't assume because you don't hear anything that everything's okay. You have to do your own follow-up. A doctor may have 500 patients, I don't know, in private practice or whatever. But again, our family member and our loved ones and our friends are our priority. And that that interest base, that's not the right way I want to say it, but we're concerned about a small number, whereas, nurses are taking care of quite a few patients and they've got a lot going on. But our focus is going to help them focus on how we can help those patients stay safe and not have harm occur in the hospital.
Right. And think about it, think of it as we're the customer, right? I mean, it's one of the few places where we don't think about that, but the if you're in the facility yourself, or you've got a family member, they're the customer. And so it's okay as a customer to be receiving care, to ask questions, to be informed, to all those things that you mentioned. It's just so important because, one of those 10,000 lives that you want to save could be one of your family members. And just by simply, asking some questions, knowing what to ask, being a little more bold, it can make a big difference, and especially if it's early on. So
Absolutely.
This has been great. If people want to learn more about you or your book, where do they go?
My website is drjuliesiemers.com. That's drjuliesiemers.com. And then the book's on Amazon. If you just search Julie Siemers and Survive Your Hospital Stay, you'll find it. So I hope everyone reads it, because I think my son just finished it and he said, Mom, I'm not being biased, but oh my goodness, I had no idea. And I feel so much better if I have to take my wife to the hospital or my daughter to the hospital. I feel empowered to ask questions. I know kind of the categories I need to look at, what questions to ask. But he goes, everybody needs this. And I feel it too. I mean, even educated people that have some healthcare background. A couple of my students that are ready to graduate read it, and they said, now we feel better prepared because we know if our patients are becoming informed, they're going to hold us. And, oh yeah, these are pearls and concepts that I need to remember. But again, nursing school is like drinking from a fire hose, right? There's so much. How do we distill it down to those pillars of health assessment that I call it? So I try to help the students refocus back on those really pertinent things, but that's kind of what we cover in the book. So hopefully an app to come. That's what I'll be working on next, that patients can have that information at the touch of their fingertips on their phone. So hopefully that'll be coming. And then on my website, I'll start posting resources, blogs to help. And so there should be more coming that will be really helpful for people to become informed and to learn from other people. The other thing, the book talks a lot about the stories, and I think that will help people. But I also want on the website people to start sharing what happened with them, whether it be positive and good, or what they learned from their experience that was a challenge or maybe harm occurred, that everyone can learn from, is just reading other people's experiences. So that's coming too.
Awesome. And testimonials from your child and your students, it can't get any better. It can't get any better than that. So again, thank you for being with us today. And again, if anybody wants to pick up her book, go to Amazon. It's going to be well worth it, and you'll just learn something. So thanks again.
Thank you. Appreciate it. Bye-bye.